Thank you for inviting us to Heartland Vein and Vascular Institute. I really appreciate you having us here.
Thanks for being here.
I'd like to know basically a brief introduction. I want to give our audience a bit of background about who you are and how we got to this point, the people that work here for you, and your overall company mission.
We started this practice approximately 3 years ago. I've been treating veins largely for over 5 years. Our goal is to try to alleviate some of the suffering that these patients go through and to apply some of the new technology to treat them more effectively so they can get back to work and the disease process doesn't progress as rapidly as it would otherwise.
People with venous insufficiencies, what age group do they usually?
We see patients of all ages. We've treated as young as 16 years old and as old as 92 years old. Vascular disease on the whole is a disease process of the elderly. The veins affect people in their productive years, and so it's encouraging to me that we can improve the quality of life for those people and reduce the suffering for that group of people.
Let's discuss technology and how you apply it in your practice.
The biggest technology boom for veins by far has, in my view, has been the advent of the ultrasound. Now, being able to incorporate the use of ultrasound technology in a practice setting has been very key to advancing this field of phlebology or vein procedures.
What is the process in itself when you come in, you use ultrasound and there are lasers that are being used right now? Let's discuss that.
When a patient comes in to see us, we automatically get an ultrasound because we know, based on what we're seeing on the leg, that there's some underlying problem, vein, causing it. So with the ultrasound evidence and what we're seeing in a patient's leg surface, we piece the evidence together to decide which vein segments to treat. If large veins are involved and we see it on the ultrasound and it correlates to the clinical picture or what the patient complains with, like heaviness, throbbing, aching, swelling, itching, a laser procedure may be recommended for that underlying vein problem. If the ultrasound doesn't correlate with what we're seeing clinically and we're not seeing the answer in the legs, oftentimes we'll pursue even higher. Another new technology called intravascular ultrasound is available to assess the iliac veins in the pelvis and the lower abdomen that often can become obstructed and cause similar symptoms or problems. Once we diagnose the problem, if it is higher up, there's many good treatments, including stents to open up closed segments of vein to improve the circulation back to the heart. We also use unconventional counseling, talking to patients about the importance of exercise and building the calf pump and the leg pump for the veins, because that's key to the vein return. And that's important for our patients as they get back to a healthy lifestyle to maintain some type of exercise program.
Sounds like you have a comprehensive approach.
We try to incorporate the new technology with an overall picture of getting a patient back to normal, healthy legs again.
From our experiences, there's a general fear with the public. They don't understand where the technology's gone. I mean, words like vein stripping are still in the general public, where vein strippings are not necessary.
Vein stripping got a bad name for a good reason, because it failed 50% of the time. The current laser procedures have an improved outcome. There's only a 5% failure versus a 50% with the stripping. And it's steadily improved over the years. When you use adjunctive sclerosant injections with the laser, you can get up to 98% effectiveness of the vein closure. Technology really has changed the face of vein procedures, and we're able to offer better outcomes and better results in a shorter period of time with fewer side effects.
There's a lot of competition. What would you say the difference in your practice is?
One of the differences that stands out in my mind is the comprehensive nature of our vein services. We're able to treat everything from the spider vein to the large leg vein to the large pelvic and abdominal veins. And there's a wide array of venous disorders and diseases that need to be sorted out and treated, including deep vein thrombosis and being able to clear clots from the veins readily if necessary. Having a vascular surgery background helps me to understand the wide array of vein problems that can occur.
If we had a crystal ball and say, okay, this is where we're going to be in the next 3 to 5 years, what would you say?
My hope is to keep up with the current technology and incorporate it into advancing the treatment of venous disorders. My feeling is that much more is understood today about this field of vascular medicine and vascular surgery, and much more. I think it's a very young science, and I think it's a very young area in medicine, and I think it has a big growth potential. There are more and more people doing research in the area of vein problems, and there are many unanswered questions about veins, and certainly we don't have all the answers, but the treatments and the technology and the knowledge has really grown in the past, and I expect it will grow in the future.
You also do things like wound care. Let's discuss these aspects of your practice.
I've had an interest in wound care before we opened this practice. Nearly 80% of all the wound care patients I was seeing were venous stasis ulcers. Once the vein problem advances to its end stage, the skin begins to ulcerate and they need to be cared for in a certain way. And so we use a combination of local treatments and compression and teach the patients what to expect about the wound care. And one goal of ours is to reduce the incidence of that devastating problem. It's widespread in this country, and it's very painful and very difficult for these, especially elderly patients, to go through.
Is this something, as a patient, go into an office like yours and expect results that are going to cure that leg pain? Is this a process that the technology cures it 70–80% only? From an average, what would you think?
Venous disease is a chronic problem, so for me to say that it's going to cure the problem is not exactly truthful. The expectations that the symptoms would be alleviated and it would minimize any future recurrence of vein problems is expected. It should be expected when someone comes into our office or any other vein clinic. When we treat a vein, there's a 95% chance it won't come back. It used to be a 50%, so it's much better than it used to be.
Does insurance cover these treatments?
If it's a cosmetic spider vein with no symptoms, the insurance company would not be expected to cover that type of procedure. But by and large, most vein problems have some underlying large vein cause, and insurance on the whole will cover symptomatic large vein problems.
Now, how do you stay current on the information that's out there?
I attend meetings, usually about 2 meetings a year, vein meetings, either American Venous Forum or American College of Phlebology. Try to attend those on a regular basis. That's a key way. I keep up by reading journals and the literature on the latest in the treatment of deep vein thrombosis. We try to learn from our own data and our own outcome.
The word healthcare, what does that mean to you?
Healthcare means, to me, overall maintenance and care of our quality of life at different seasons of our life. That includes treating disease processes as they come up and preventing them before they appear.
Dr. Whittle, you have a comprehensive approach. In conclusion, let's discuss this approach.
Well, a comprehensive care to the patient means assessing, all the important areas that go into a healthy lifestyle. We want to treat them all the way from improving their muscle function in their leg, improving their discomfort from their vein disease, offering procedures for their varicose veins, to wound care if they need it, to diagnosing problems if there's a concern for deep vein thrombosis, to hospital care if that's necessary. And if we don't have the answers for their problems, we want to help our patients find the right places to go and find the right people to contact.
Let's sum up Heartland Vein and Vascular Institute. Give me the brief.
It's overall health care for patients' vascular disorders, especially vein problems. And it's compassion, it's excellence in care, it's being certain that the problem gets taken care of.
Thank you, Dr. Whittle, for inviting us to your center and sharing all this knowledge-based information, and we wish you a lot of luck and Godspeed.